Good, right. Good evening, everybody. It's coming into the room. 1 second. Good. Okay. Well, good to see you all again for another chat into the group by myself. So say hi when you come in. I'll just give people a chance to come on in. I can see people. Hi, Craig. Hi, Kim. Good to see you. Good to see you. Good. So as you can see, hi, Sajani. Nice to see you. Good to see you here. As you can see, I'm not in Dog CC HQ. Hi, Nikki. Hi, Sally. Hi, Ingrid. Hi, Helen Algrave is coming in now. This is nice to see. Hi, chap. I'm away at the moment, but so I don't have my normal background. But for those of you who know us, we sometimes look after our friend's place, and they've got 3 Afghan hounds. So I've got six doggies here. Our 3 that you probably know anyway, and the Afghans. So 6 dogs. So it could get quite animated at any moment, but they're all resting nicely at the moment. So that's all good to see you. Well, good to see you, especially on a Sunday afternoon. And clearly you're either interested in this or nothing better to do. Either way, you're very welcome. So what I wanted to do, this is another little chance for me to chat to the group, really. Just so you know, I will be having guests back in. You won't have to put up with me all the time. And I've got some amazing guests to line up. And I'm just finalizing some dates on these things with a really important series of topics. So I'm going to start sharing some of those in the group. We've got some returning names like Robert Faulkner Taylor, Daniel Shaw, Amber Batson, Maya Rose. We've got some newbies like Matt Beisner, Tamsin Thurston, Laura McAuliffe. There's quite a few, lots of people. So I'll share all that with you. Anyway, what I wanted to do was, when I was talking last time, and thank you to everybody who came last time, and thank you for the great feedback. I had a lot of messages in the following days, and there was 2 really kind of camps. There was one which is, I kind of get this stuff, but I struggle to maybe put it into the right words or to formulate it, and that was really helpful. And those who hadn't had that slight mindset shift or we're not sure about some of the things we need to think about. So that was really helpful. And in the comments and also with a lot of the feedback afterwards was about the challenges we have when we're trying to support somebody to see their dog differently, to move away from a lot of the norms, especially here in the UK. There's different kind of cultural norms, I guess, around the world. But here in the UK, we still have a heavy focus on dominance, for example, dominance kind of hierarchies. When we think about what is on telly, a lot of what's on telly is a good 30 years out of date. Thankfully, we've got people like Victoria still on telly doing her bit along with the gang, especially in the UK here. We have the Dog Academy, which is really good, trying to look at things a little bit differently. But it's hard, right? And especially on social media, there's so many voices out there now who are really pushing to try and the old tropes of, well, you've got to provide a consequence for this behavior. The dog has to be shown who's boss. The dog must be put in their place. So I just wanted to talk a little bit about this today. And as always, I always like to start by saying these are just my thoughts, and I welcome yours. But for me, I think we have to think about this. So let me start off then, and I'll build things up. And I want us to have a real good think about some of the psychology behind this today, because it's really important that we understand a lot of these component parts. The first thing I want to say is, I think as a professional, so for the professionals in the room, whether you're groomer, trainer, behaviorist, veterinary, whatever, going into a situation already with a mindset of thinking that we have to change another's approach, that we have to get them to see things in a certain way or do things in a certain way, already is a little bit problematic for me, because I don't think that's what we should be looking at as our primary initial goal. And I'm going to explain why that is a little bit. Because we've all worked in cases, right? We've all been there, and myself included, where we've done a lot of work with somebody. we really feel that we have influenced them, that they're really seeing their dog's needs and move them away from a kind of a compliance, obedience, consequence, negative consequence approach. And then we hear that when we think everything's going well, they've ended up going to the punishment trainer down the road. And it can be very easy to then think about, well, we must be doing something wrong then. It's our fault. I see a lot of these threads come up in my various professional groups where people are like, you know, I can't believe it, where have I gone wrong? I feel like I've let this dog down. I want us to think about whether that is actually the case. Now, one of the things that gets said on the punishment side is, oh, you know, we're the ones who have to pick up the mess with these positive trainers, but they still come to us as though somehow we've done something wrong. I just want to challenge some of that a little bit today. So I just put a post up in the group actually that touches on this a little bit. And what we've got to recognize is when we come and meet somebody with their dog, especially with the way we want to work, which is more a case of trying to understand that dog's care and support needs and trying to work through those things and being more empathetic in the way that we work. We have to recognize that the people we're working with may already have a set view on what is actually already happening, which is influenced for them by their own belief systems, their value systems. And I think this is where we get the kind of the friction sometimes. And I want to unpack some of that, because if we go in with an approach of thinking, right, my primary goal here is to get you to do something, a lot of the time, this is not just in dog training, it's the same in any part of life. There is a chance that the person may well be threatened or judged by even just that. Even just saying to somebody, can I give you some advice? Might be enough to set off their defense systems. We might get a situation where we're like, oh, no, you've got to do it this way, and I'll only work with you if you do this, and all this kind of thing. That they might do it, but they might feel uncomfortable with it because of their internal belief systems, value systems, because of their own structured biases, or they might end up having friction with what they're doing. It's they're thinking, right, the dog trainer's told me to do it this way, but it's going against some of the things that I might believe or I think I believe about this setup. And that creates more stress. Or they'll do something when we're around, but they're not going to do it when we're not, which is another common thing that we see. So it's not as simple then. When we're thinking about supporting them, I want to share some of these thoughts. I'm going to go through a few more bits and bobs here. Someone's struggling with this. Can other people hear me? I hope you can hear me, Margot. That's okay, but I hope you can hear me. I hope everybody else can hear me, right? So I just want to unpack this. So, because it's really important for me to go through the different stages, and then I'm going to give you some practical stuff as well, and I'm going to share with you a little bit about how I go about some of these things myself. And I bring a lot of my kind of human support bits to it, because that's what we're trying to do. So we all, when we become as adult humans, there comes a point where our brain decides upon a safe worldview. In other words, it's decided that it's got enough information to think this is how I'm going to perceive the world. And that's often based on information that is put in there by others, actually. We're very susceptible when we're younger to the beliefs and values of those people around us, and we often don't question those. When we think about a belief is what we believe to be true, often actually with very little evidence for it. And our values are what we feel to be important. I really like Schwarz's theory of human values. It's a great model. If you look up that, Schwarz, S-C-H-W-A-R-T-Z, Schwarz's model of human values, it goes to try and plot some different things. So, for example, if you're somebody who values tradition, values security, values conserving the status quo, then you're more likely to have, for example, a conservative value system with a little c, you know, because that's the thing. If you're somebody who believes in more in the individual and the right to kind of self-expression and moving away from conformist norms, you're more likely to fall into a value system if somebody's more liberal. This is important even when we work with a client, because if you have a more conserving value system, that can make it difficult to, oh, freezing, people saying it's freezing a bit. Oh, it's fine now, okay, good. The value system, if you are more of that conserving value mindset, then you're more likely to think that behavior has to be constructed in a way that fits some conformist norm. In other words, there are expectations of behavior. That is good behavior, that is bad behavior. These are really important because they create people's, as I say, their outlook, and perception is everything. I keep saying that in all the things I talk about, because how somebody perceives the behavior of another, how somebody perceives a situation, does go a long way to driving how they're going to respond to it. We have to understand this when we come and work with the general public. Because if their perception of their dog is that their dog is naughty, bad, difficult, challenging, dominant, if their value system is very much grounded in this notion, well, there must be a consequence, because, you know, that's not acceptable. There must be a consequence because that's how they've been brought up themselves. That's how their own response to their own trauma often has created this outlook. So this is why I think it's important that we talk about some of this at the beginning, really. Now, the brain doesn't like, especially the adult brain, doesn't like to have to reappraise those things. That's why when that safe worldview is created, it often wants to protect that. The wonderful Laura Donaldson in her work talking about canine cognitive reappraisal. Cognitive reappraisal is actually really quite difficult. Cognitive appraisal is what our brain does with instant judgment. And we love to judge, right? We love to judge. We all love to judge, and we can't help judging because our brain's designed to do that. It wants to make an instant response based on often the smallest bit of information, based on the filters through which that information is going through, which will be our worldview, our belief systems, our value systems. There's a thing that we say that humans love to judge, but they hate to be judged. And the reason we hate to be judged is because we know our own lived experience is a complicated one. You know, I could make a judgment about you listening now, and you could quite rightly say, well, hang on, Andy, you don't know me. You don't know the day I'm having. You don't know what I'm dealing with at the moment. But the point is, the brain wants to make these cognitive appraisals. It's efficient, it's quick, it's good from a kind of a survival point of view. You know, we don't have to keep reappraising everything all the time. You think, hang on, I think I know this, feels safe to me, I'm going to stick with it. Even if that information has no grounding to it. There's a lot of things that we have with part of our belief system, especially what we believe about ourselves, that actually has been put in there from others, not even from our own experiences, actually. So cognitive appraisal, really easy. Cognitive reappraisal is difficult. I did a talk with Holly Tett, Dr. Holly Tett, on her upcoming summit. We were talking about this, and obviously Dr. Holly's a clinical psychologist, so she understands a lot of these things and how hard it can be to actually navigate our own biases and to truly turn up to somebody else's needs, somebody else's care and support needs, without being influenced a lot by our own judgments and that kind of thing. So actually it takes a lot of practice to do that. It's not easy. It's not easy to have somebody challenge potentially that perception. So we have to be really mindful of this. And for us, because we can't not judge, so we shouldn't beat ourselves up about that. What we can do ourselves as the practitioner especially is learn to how we change our relationship with judgment. So we know our brain's going to judge. We might go and see a client. We know already they're using shock collar. We know already they've done this, that, and the other. It's very easy for us to allow that judgment to drive our response. And this is how we change our relationship to judgment, how we change our relationship to the feelings we have. Just because we judge doesn't mean we have to become judgmental. And just because we've thought, that doesn't feel right to me, we can just take a breath and think, right, but I'm not going to let that influence or drive my response. I can become more available. And I'm going to come on to how we might do that in a minute. So I've just given a little thin snippet of a lot of the psychology that goes on for the individual. So it's no wonder then, when we think about it, that even despite our best efforts sometimes, some people cannot navigate that stuff to actually let go of some of the things that they already feel driven to do as a response. And actually, you know, I had you know, people in local Facebook groups, you know, somebody asks about a behaviorist and people list people, don't they? And my name comes up along with other amazing colleagues in the local area. And one lady who I worked with her a little while ago, and I actually share this kind of comment in some of my emotional workshops. I do emotional support workshops for professionals, because she said, definitely not hail, capital letters. He made my dog worse. Go to this guy instead. And she mentioned another person. Now, it's really easy for us as professionals to read that and our brain to want to make it about us. You know, it's and part of my brain, that more defensive part of the brain, did want to on first reading. I was thinking, oh, she's saying something about me. But actually, I took a breath. I changed my relationship with that instant moment. And I thought, well, actually, what does it say to me? Because the facts are, I work with a lot of people, and the vast majority really see value in what I do. But there are some people who don't. And actually, when I read that, I thought, right, because I knew this person, it's a shame we can't leave reviews for our clients, right? Like you can with the Uber driver, because I think that could be quite interesting, but perhaps not very professional. But it was a hard case, because for whatever reason, it was very difficult for me to persuade her to let go of what she felt was needed. And actually, the professional that she highlighted in that was a punishment-based trainer. So when she said he made my dog worse, that just reminded me of what I know of working with her, that she could not take responsibility for her dog or her dog's needs, because that's what I found. And secondly, she went to an aversive trainer. So she got what she wanted. She got the outcome she was looking for, actually. It's like when somebody asks us advice, right? Sometimes they're not really asking us advice. They're waiting for us to tell them what they want to hear. And this is the thing about things like confirmatory bias. You know, she got what she wanted from that trainer in the end, something I could not provide for her. And this starts to change the dynamic now when we start thinking about these things. So how do we navigate some of this stuff? I think one of the first things, and this is what I ask anybody who's come to my emotional health workshops for professionals, a really important question that I ask is, who are you as a professional? What are your beliefs and value systems? What do you feel you're there to do? I think sometimes if we're not secure in understanding that, which sounds quite a strange thing, well, who are you? Well, of course I know who I am. But do we though? Do we really know more generally who are we, especially under the burdens that we have of the expectations and judgments of others and the labels we kind of pick up during our lives? But that's another topic for another day. But as a professional though, what do we think we're there to do? What is our aim? What are our negotiables and what are our non-negotiables? And if we don't have a secure base to even start from, and especially if we have a little niggle in our brain that we're not good enough, we can all have periods of that, I know. But if we are turning up thinking, right, I must impress on this person how good I am, I must impress on this person that I know my stuff, we can end up having that first session with us mainly telling them stuff to make it look like we know our stuff. And I think if we fall into that, and we've all been there, by the way, that's a little sign that maybe our foundation of who we are as a professional needs a little bit more work. So for example, I don't do training classes, but it's the same as whether you do a training class, same if you're a groomer, same if you're it doesn't matter what you do. I know what I'm going to do when I get there. I'm going to turn up, and my first job is something I call supported awareness. That's what I feel. I'm not there. It's interesting that we share a lot of articles, don't we, about it's not a quick fix. We're not there to fix the dog. But how many times do many of my colleagues turn up with a fixing mentality without even knowing it? I must show that I can change something. As I say, I think that kind of mentality, or the one of I must get them to do this, we're already setting ourselves up to have a problem sometimes. So supported awareness for me is, my role is to try, and I say try because I already recognize that I can't for everybody. I'm going to try and support my clients' awareness of their dog's care and support needs, together. This is why we have the 3 A's that we talk about a lot in human therapy. The first A is awareness. I want to talk more about awareness from our point of view in a minute, because obviously as the practitioner, we also have to be aware of the dog and the caregiver and their needs as well. But more generally, awareness is the first thing. I think we have a crisis of welfare in dog ownership, not because people are deliberately cruel or horrible. Very few people are, we know, but mainly because there is a lack of awareness within the general dog owning population about who dogs are and what dogs need. So so that's why we're already hitting against something quite structural and quite societal, because they've already been indoctrinated into this notion that, as I said in the piece that I shared in the group earlier, go and have a look in a bit, most people are indoctrinated into what we class as the good-bad continuum, this notion that somehow behavior is on the spectrum of good to bad, and that we reward the good and we punish the bad, because it seems so right, doesn't it? Until we start asking questions about who's deciding what's right, what's good or bad, what drives those narratives. And often it's an attempt to control and coerce others to fit a conformist narrative that that person wants. That's in the piece you can read in a bit. But the point is, the general public, and I'm talking predominantly here in the UK where I work, it already seems to make sense to them. So when you've got somebody like the guy on the South End dog trainer, whatever it is, may as well name him, why not? And other people on the telly saying, oh yeah, well, this behavior is bad, we've got to stop it. We need to punish it, and then we might give them a treat afterwards if we get the good stuff. It fits for the general public of what's already what their worldview looks around these things, because they're the victim of that construct already themselves. So it's quite powerful. So we need to turn up. This is what I feel my job is, to turn up and support the awareness for them to support their awareness of their dog's care and support needs. Once we've done the awareness bit, that's not the end of the job. That's just the beginning bit. So if you're a vet listening in, I've talked about this on the CAM platform, Canine Arthritis Management. We need to help the dog become more aware, help the client, the patient, or whatever client, to become more aware that their dog's in pain. If you're a groomer, to let the client become more aware that the dog can't look like that at the moment because they need a welfare groom, or there's a problem here, or there's a problem there, or make them aware that the dog isn't coping, or make them aware that it's too much. That's only the beginning bit. The next bit is acknowledgement. We've got the 3 A's: awareness. The next one is acknowledgement. We need to support them to acknowledge that. Many vets struggle with this. Speaking to Hannah Capon, we're like, okay, actually your dog isn't doing this, that, and the other. They can't do it because they're in pain. It's hard for the caregiver to acknowledge that their dog is in pain. It's hard to acknowledge that maybe their dog can't do that 5-mile walk a week. As a dog trainer, behaviorist, it's hard for them to acknowledge that their dog's not just being a dickhead or being dominant or being difficult or stubborn, that actually their dog's stressed, that their dog's uncomfortable. It can be hard to acknowledge that. And this fits into that worldview thing. So another job for me then, I think, right, I'm going to help you as best I can to become more aware of your dog's care and support needs. And I'm going to share with you in a minute how we can look at some of those constructs. Then I need to support them to acknowledge that and to try and work out what it is that means they can't acknowledge that. How do I help them to navigate their own beliefs and value systems? And I say help them to navigate, not tell them to. It's an invitation. Everything's an invitation, guys. Even training, even asking a dog to do something is an invitation. It's a request, because they're either going to do it or they ain't. So help them try and navigate that so they can acknowledge it. And then the final A, and it's not too big a leap actually to get to the last A, and that's acceptance. So they're aware of it now. Okay, so my dog isn't being this, this, and this. It's actually because they're stressed or they're uncomfortable or they're not coping. I've now acknowledged that. I understand that. And now I can accept it. And actually, often it's the acknowledgement bit that people struggle with. We have to help them with that. That lady who left that thing in the Facebook thread that I was talking about, despite my best efforts, I couldn't get her to acknowledge it. I think she was aware of it, but she couldn't acknowledge it because it's easier to acknowledge something different, especially something that's already pre-programmed, right? Acceptance, the kind of move from acknowledgement to acceptance is often not that difficult, but even then there's some reasons why people just can't come to accept it. They can't come to accept that. And again, my job is to try and help them with that. But there's a lot of trying tos here, isn't there, right? If you get to acceptance, that's where we all know that acceptance gives us that best outcome, because there's something about acceptance that allows the brain to kind of almost unlock those advocacy circuits where they're like, right. And that's one of the best shields to expectations. Expectations, when you think about it, is about control. If I expect something from you, I am seeking to control an outcome based on what you do. The expectations that we have for ourselves are often programmed in by other people back in the day who sought to control outcomes for us. So something to bear in mind. That's why we have to change our relationship with expectations as well. Now, there's a lot of people who run classes who say to me, yeah, this is all great, Andy, but I know these people are going to come in with the expectation of coming to do the normal obedience stuff. This is where we have to be really clear about who we are. It's the same with my work as a behaviorist. You know, people say, yeah, but they're going to expect me to come in and they're going to expect me to give this and this and this. There's two things I'd say about that. First of all, we're making a huge amount of assumptions about what we think somebody else expects. But as part of that, we have to recognize those expectations will be based on the worldview they have right now. So the second part of that is us having confidence in our ability to show them something different and to feel very secure in that and knowing that it won't be for everybody and not everybody's at that point. And there could be a lot of reasons around their own mindset, their own upbringing, their own trauma, who knows, that means that they can't do that. And if we're not careful, we can end up lambasting ourselves and heavily focusing on those and missing all the others who are like, oh, wow, God, now you've shown it, it's amazing. You know, a lot of my colleagues like Matt at Southwest Dog Skills, Matt Donovan, Lucy Alders, Helen Moore, there's lots of people doing dog training classes that seem quite traditional from the outside, but when you actually see them, they're very different. And the feedback I get is the same with grooming, right? A lot of groomers are like, yeah, I know, but I feel under a lot of pressure because I don't, you know, if I don't provide that task done, they might go somewhere else. But having worked with a lot of groomers, and done a lot of education for groomers and people like Sue Williamson and Steph Sickerman and others, the vast majority of the caregivers, because they care, right? They're like, oh my God, didn't realize. And I'm really thankful that you didn't push it today then, if that's the case, and I'm happy to be guided by you. You know, so I think it's important that we have to start off from a place where we're really confident in what we think we're supporting, you know, what we're providing. I know that there will be some people who don't value what I do. Now, this is very important as well. If you end up working with clients and every other client is going off to a shock collar trainer, or you're really struggling with all this stuff, then we do need to bear that in mind. We might need to step back and do a bit more reappraisal of how we deliver things and what we do. But for the vast majority of my colleagues listening now, we you know, I keep like a crib list of my clients, and I can see if I feel I've had a particularly challenging outcome. I can look at that and think, do you know what, the vast majority of people I work with do appreciate the support I'm giving them and really value the mindset that comes with it, the mindset shift. We shouldn't be too focused on those few that don't get it, aren't prepared to get it. I've also had clients that I've worked with. I had a lady who saw me about 3 or 4 years ago, well, before COVID, who wasn't ready then. And she went off and saw some other trainers and did other stuff. And then it clicked and she thought, yeah, actually training more is not the solution. I need to listen more. And I learned that from Andy. So I'll go back to him. So we have to be really secure in what we need to think about. So awareness, acknowledgement, acceptance is the journey we're supporting people to go through. And it's the same if we run a dog training class. If somebody's like, yeah, I'm here today because my dog's pulling on the lead and we can see the dog's pulling like a train. In their head, they think, right, I need to get my dog to walk nicely. Part of that awareness for us of letting them know is yeah, do you know what? I hear the goal we need to do, and I'm going to support you with that goal. But we need to recognize that one of the reasons your dog is pulling so much at the moment is because they're being triggered by the traffic, or they've got generalized anxiety, or that they're too fizzed up, or they're too young, or whatever it is. You know, it's that level of awareness. And it helps them because supporting a task-orientated outcome, especially if we think we have to show that we can do our job, it does leave us open to the task not getting done. And the problem with that is it creates a bit of a blame structure. Either the dog's not doing it right, or the dog's no good, or the client's not doing it well enough, or the trainer will feel that I can't do my job. I'm not doing it well, because we've ended up down a cul-de-sac of trying to get tasks done with a dog who can't do it. So that awareness comes to us as well, by the way, that element of awareness. So we have to think about then, if we're turning up to think, right, I'm going to make you think something. This is what we see on social media, right? Piling in, trying to shame and make people change how they do stuff. There's a good chance they ain't going to do it, right? We have to provide invitations. We have to provide safe spaces. We have to, especially when we're working with a client. Like I said at the beginning of the chat, if we're already going in with an expectation of our own, that they must do this, they must do that, we're already going to have a problem. So a couple of little examples here. I went to see a dog because the dog struggled around other dogs, and did a bit of work with them. And then I ended up going back to their home at one point, and I noticed some anti-bark collars on the shelf, which hadn't been discussed with me. I didn't know anything about them, and I asked them about them, and we had quite a good supportive relationship, and they told me, and it was because the dog was barking in the home when the dog was being left. And the easy thing is to say, oh no, well, we can't have them, and I won't work with you if you use them. But because I gave them a chance to share their story, and that's what I'm going to come on to next with Cake, they were living in social housing. They'd already had their final warning, and one more, and they'd be out of a property, out of a home. They were really lucky to have social housing that allowed a dog in the first place. And the anti-bark collar was working from a non-barking point of view. So who am I to tell them to risk your home and potentially having this dog go into rescue now because they can't stay together? So we worked through it together. Our goal was to remove that anti-bark collar because they were more aware of their dog now, of course, and different things. And we worked through it, but it wasn't a cliff edge. There's another lady I've worked with very recently, actually, who had a prong collar on. We don't see many prongs over here in the UK, but they are around. And guess what? It did help the lady to manage their dog. It just does. This is why they're so appealing, I think, because they kind of help from a task point of view or from a stopping point of view. And again, the person that she went to see originally or reached out to said that the condition of working was that she had to get rid of the prong collar, and that put her off because she already felt judged and she already was scared of the outcome. So I said to her, I listened to what she had to say. I'm going to come on to that in a minute because that's Kate. And we worked through a few things together. And I said, look, let's do a structured setup first. In that environment, I think the dog will be better off on a harness. Let's get a dog used to a harness and a long lead, and we'll take it from there. It's a safe environment. And so she was up for that because a lot of the time, people use aversives. They talk about discipline. They talk about dominance. Because actually underneath that, in their mind, their belief system has told them, this is how I keep my dog safe. So that's the level that we can connect on. Oh yeah, we all want to keep your dog safe. Great, let's think about it. So it's that negotiation. It's a negotiated outcome. It's not a red line. And then by seeing the dog with the harness and the long line, things started to change and shift. And we were able to get rid of the prong, and it didn't take long, actually. And it became more powerful because she was able to come to those conclusions herself. Another story, which I've shared many times, people might have heard this before, but I worked with a gentleman who actually, we became quite good friends over time. And really blokey bloke, as I call them, very butch, ex-military, divorced, living on his own, got a dog. Dog used to lunge and bark at doggies. He used to hit the dog with the end of the lead when he did it, to whack him on the bum. And so again, if I'd have tried to just make him not do that and do something else, he might not have wanted to work with me. He might have not done it when I'm about, but still done it when I'm not. We've all done that, right? We've all driven past a client and we're like, I can't believe what they're doing. Even though I said don't do it, they're doing it. But anyway, through this process I'm going to share with you now, Cake, he was able to say to me, through his own awareness, acknowledgement, acceptance, going through those kind of processes of his own behavior, he said to me, do you know, Andy, I know why I've been hitting my dog like that. It's because I'm angry and I'm embarrassed. Those were his emotional drives in the moment. And his realization of that became really powerful for him because, you know, he is now going to be less likely, and actually because he's become a bit of somebody I know quite well as a friend, I know he doesn't because his dog's doing amazing. And actually it's been transformative for him. I mentioned this in the piece I shared in the group earlier, that thinking about things, moving away from that good-bad continuum, having that shift in mindset, if we're able to, it unlocks us all actually from the shackles of these conformist expectations on how we should be and what we should do. And it definitely was for him. It was very freeing for him, actually. So because he came to that realization, he's not going to do it, is he? Because he'd realize it and is more likely to think about his own, how he moderates his own behavior. So, Cake. I just want to talk about Cake before we finish up. And then I'm just going to tie it together a little bit. I love CAKE as an acronym. So CAKE stands for Compassion, Awareness, Knowledge, and Empathy. Compassion, Awareness, Knowledge, Empathy. Compassion is what allows us to turn up in the first place. Compassion is not about condoning. It's not about supporting. It's not about, you know, if somebody's doing something not very nice, and the fact that we turn up for them anyway, that's just being compassionate. And this is very important when we're supporting people. We want to turn up anyway, even though we know they've used a shock collar or prong collar, even though they've done things in a certain way. So compassion allows us to enter the room. And then awareness reminds us that we want to be truly aware as we can be of their lived experience. I'm talking about the human here. The same applies to the dog. But this is why I always start with the human. I can't stress this enough. To get these kind of outcomes, in my experience, we need to do it in a certain order. And I'm going to share that with you in an MO as well. So compassion allows me to turn up. Awareness allows me to try and navigate my own biases. This is really important. All the stuff we talked about applies to us, right? We have a worldview. We have our own belief systems, our own value systems. We judge. We have our own expectations from those judgments, and we have to change our relationship with all this stuff. And actually turning up to the lived experience of another without allowing ourselves to be in that judge state is tricky. We have to practice it. One of the golden rules of being a human therapist is that if you're going to turn up to the care and support needs of another, you need to be in as well-regulated place as you can be, for one, and also to navigate your own biases, because they don't mean anything. What I think doesn't matter. What I feel doesn't matter, ultimately. I have to bear witness to what they're feeling and what they're experiencing and where they're at now. I have to meet them where they are. So being aware of that is really important. And then knowledge, we have knowledge, of course, we have knowledge. And we can often make a mistake of trying to show that knowledge first. But actually the knowledge we should seek early on is knowledge from them, learning from their dog. This is the same whether you're doing a puppy class, a training class, a behavioral consult, or groom, anything. It's giving them chance to share their story. And if we have compassion, awareness, and knowledge, true knowledge, which means we have to be quite humble on that and hear them with the vocabulary they have, then it helps us to be more empathetic. And I think that's the key. As part of that, I have my T acronym, because us Brits, we love T. And the T stands for time. It's to give them time to share that experience. And then the E is encourage them to share it in their language, on their terms. It's no point if they say dominance or discipline or whatever, that we keep diving in and saying, oh, we don't really say that anymore. We need to encourage them just to share their story. We can address that later on, because when we start showing things from a more care approach, all that other stuff melts away anyway. They don't need to be told it, they can see it. And then the A of T is acknowledge. Acknowledge what we feel we've learned. You know, what I feel I'm hearing from you is, and have that conversation, you know? And so for me, it works in three ways, three little component parts. And actually the dog's the last bit. I find if we want to try and get people to support that shift from task to care, we need to first of all hear their experience first. We need to try and access their lived experience and understand why they have a more task-oriented approach, because most people are in task when I meet them. The task being stop the dog pulling, they need the dog to be obedient, they need the dog to be trained, they need the dog to stop growling or biting or barking. And to hear it, and also to hear from them, how's it affecting you? Now, I've heard trainers say that they feel under a lot of pressure at that first consult to try and show the person that they know what they're doing, or to leave them with some training to do. I would argue, in my experience, the most important thing that the client needs to know is that they've been heard. Even if what we're hearing isn't necessarily what we think we should be hearing or that we think is helpful, it's what they need to share with us. And it helps to build a little bit of a foundational trust with us because they can share and they can share how they're feeling. This is going to be really important. The next thing I tend to do is then I start to talk about the emotional experience in quite a neutral way. I talk about, you know, how much we share with dogs and how important safety is. And I interlace a lot of human stuff because we can. It's not being anthropomorphic. We all know what it needs, what all these things feel like. I like to use the term relief because for me, that's the most important word in the psychology of behavior. And, you know, the vast majority of people, when you talk about relief and you frame it right, they feel it. Because that's the whole point. So for relief, I might do a little chat just on relief at some point, but as soon as you feel something, as soon as you have that, you know, physical pain, emotional pain, social pain, especially the negative stuff, part of that is to drive yourself to find a way of not feeling that. That's the point. It's like, oh, this doesn't feel good. I don't want to feel it anymore. So a lot of behaviors are actually relief seeking when you think about it. We all want relief. We seek relief. So they understand that. They understand that themselves. Guess what? The reason they've come to me is because they want relief. So this is helpful to give a frame. I talk about the bucket analogy. We all have the good old bucket. I've got my doors of the brain analogy. More than welcome to use that one, which goes nicely with the bucket. So if you imagine the brain has lots of little doors in it, we need as many doors open for a chance of the brain to have the chance to take on good information, have the chance to work things out and have a rational response. But pain, trauma, stress, they're all big door closers, right? And the thing is, we know that ourselves. We know I can't even think straight right now because we're too stressed, right? Or too uncomfortable. And then talk about the bucket, you know, the more that's in the bucket, the less doors we have open. It's as simple as that. This is like trying to kind of bring what we know with the latest behavioral science and neuroscience into a really simple metric. So we can then think to ourselves, okay, what we're doing now, do we think we're opening doors or closing them? Do you think we're putting in the bucket or taking it out? And it's just a nice point of reference. Then I use that analogies back to the caregiver. And I can say, so actually, when we think about this, then when you're in that situation, I bet your bucket's pretty full as well, isn't it? And I bet this and I bet that. And they're like, yeah. And then they'll share more with me, which is great. So we haven't even talked about the dog, but now they think, oh, this guy knows me. It's not about what I know. It's just that I feel this guy knows me. And it really does help. It helps a huge amount. And I say it's the same whether you're a groomer, you know, in your own field. It's like, okay, let's have a chat. What are your expectations? What do you need? You know, what do you think about the grooming process? What do you think is important for you? And then asking people, you know, I love this little phrase. Would you feel comfortable sharing with me X, Y, Z? And this is the case when we're navigating through acceptance, acknowledgement, awareness, acknowledgement, acceptance. When people are struggling with the acknowledgement and they're like, you know, I'm sorry, but this has to happen, or I don't see why that should happen. Rather than come up against them, I want them to feel safe enough to tell me, would you feel comfortable in sharing with me why you think that is a good approach? And then if they tell me, then I'll say, okay, and how is that approach working for you? Because I kind of know the answer, right? Because it isn't really. So this is just building that up as we work through. So cake and tea are really important. This notion of learning the emotional experience of the caregiver first, putting a framework in place so we have a shared language now, relief, sensitive, support. They can talk in however language they want. They can say what they want. I don't need to challenge that. I just need to keep using my language because I can influence. And if they start to feel it, that's it. You have to feel that shift. You can't just be made to do it. And I think this is where we find people who aren't feeling it. They're pushing against their own internal biases. So they'll do it for a bit, but it's not the answer they wanted. So they'll go elsewhere. And do you know what, guys, ladies and gents and everything? Say guys, I know guys aren't good things about it. Anyway, it's important that we understand that we can't support everybody's shift. There's a million and one reasons why they might not shift. I personally feel, and some people don't, I know, but we can't be responsible for final outcomes there at the end of the day because there's too many variables. There's too many variables, even if everything goes well, right? Because we know a fraction of a fraction about how the brain is and physiology, and we're not particularly brilliant at diagnosing pain in dogs, especially visceral pain. There's a lot of things there, let alone all the other things we talked about today. So I think we have to be realistic when supporting people shift from task to care. It is not, that shouldn't be our prime objective. I think we have to think about making sure that we're turning up ourselves in that authentic way. And this is what I'm here to offer you. And if I can help you to go on that journey together, we'll see where we go. But we can't make people. We just can't. And I think we mustn't let other people's decision or their own journey influence ours. It's very hard, I know. And it's very challenging when you feel you've invested a lot in somebody and you feel you're getting somewhere and then they go off and use something else. But that's just their journey. That's their story. And part of it is because we feel that we've somehow failed. But how can we have failed? We've just got to turn up. We're failing if we're doing it all the time and never getting on anywhere. But that's not the case. There are many people that were ready to hear it. So it's important for us. So hopefully that's helped a little bit this evening, just looking at some of the psychology behind this and what we're up against, and especially what we're trying to do with a lot of the stuff we talk about in the group here. And this, we're not just challenging pre-existing ideas about dogs. We're challenging the very fabric of the constructs of a lot of societal norms. The same thing's happening within progressive child educational psychology and development. I've got some speakers coming up this in the next few months, talking a bit more about this from that area, because I think there's a lot we can learn there in the way that we are with doggies. We used to have a big push that children have to behave in a certain way. Jerry Lee Kroll, who I mentioned in my piece, talks about there's a difference between quiet and compliant and calm and well-regulated. And Jerry works as a clinical social worker trying to change the approaches within the adoption system. And I think this has a big resonance with what we think about with rescue and shelter, of course, because it has been, the onus has been put on the child to somehow behave in a certain way for them to be adopted. So the narrative there is very clear to the child. If you behave like this, somebody might love you. If you dress like this, somebody might take you. If you're yourself, somebody might not. Oh my God, what a message early on, especially for those children who they are themselves are already pushing some of those conformist norms. I think very much about children from the LGBTQ community for a start, I'm thinking about. And we see something, so actually what Jerry's trying to push is the onus should be on the adopter to understand and be clear about the care and support needs of the child. And that's kind of what we're trying to do, isn't it? Whether, even if you're a groom, it's like, do you know what, I can do that groom for you, that's great, and that could be our goal, but do you know what, I really feel your dog's not coping with this right now. And that's information for them. It's an invitation. They might think, oh, sod this, that's not what I want. I'll go down the road to the power groom and he'll do it. They've found their answer. What can we do? I don't know what we can do. We can't force people to have a mindset shift. They have to feel it. The onus on us is to keep educating ourselves and how best we can, by understanding some of the psychology today, looking at having more education about communication skills, about counseling skills, because there's an element of counseling on everything. There's an element about negotiated safety on most things, in grooming, training, behavior, veterinary, doesn't matter what you're doing. So find out who you are and do it on purpose, the great Dolly Parton said. I know that because my husband is almost married to Dolly Parton, as people know. But I love that. Don't you think that's a great quote? Find out who you are and do it on purpose. And I think that's the same for us professionally. I know what I do as Andy as a professional. I'm always reappraising that, always moving forwards, always shifting things. But ultimately, I have to feel really confident that when I sit in somebody's front room or go on Zoom with them, that I know what I'm there to do. And for me, it's that process of supported awareness, supporting somebody else's awareness. And sometimes we can, and occasionally we can't. Or maybe we can't right now, but that awareness comes down the line. Good. Well, thank you for listening in tonight again. And it's been great. As I say, I'm going to do a few of these here and there, but that will be it from me for a little while. But if there's anything you really want me to talk about or have a chat about or share about, let me know. And I'll always do my best. And there's a lot of things coming up at kind of conferences and stuff. I just want to share that with you, especially if you want to hear me present and other amazing speakers. We got Victoria's Stillwell's conference, 19th to the 21st of April. That's online. I'll share these in the group. I'm really excited about this. So Hannah Capon at CAM is organizing the first chronic pain symposium. This is going to be huge, everybody, because we all need to, you know, as I think some of you saw the share from Robert Faulkner Taylor, the amazing Robert Faulkner Taylor, with his chronic pain myths on the lead up to Christmas. What a great series that was. It's powerful. The clinical colleagues, ourselves as behaviorists, as trainers, as groomers, we've all got a role in trying to understand and navigate and evidence base this notion of chronic pain. So Hannah's putting together this chronic pain symposium. It's the 6th to the 7th of April. I'm going to be talking at that, not about the chronic pain, but about the kind of the care side of stuff on that. The Dog People Evolution is happening in Sweden. That's the 28th of May to the 2nd of June. That's going to be online as well as in person. I'm going to be popping over to Sweden and doing in person there. I'm at the London Vet Show again this year, 14th to 15th November, if you're clinical veterinary. So the talk went down well last year, so I've got something else up my sleeve this year. And then, of course, Daniel Shaw's event in Kent in November, which is a really amazing lineup. Sarah Fisher, Sindor Pangal, Robert Faulkner Taylor. We don't get enough of hearing Robert talk, actually. Michael Shikashio, Amber Batson, Helen Howell, who I'm hoping to get to come in the group. So that's a good line. So anyway, I just want to mention those. Keep an eye on the group for those different bits and bobs. And thank you for tuning in. And the next Facebook Live will be with a guest, so you don't have to listen to me again for a little bit. But great. Thank you very much. Thank you for everything you do. And thank you for keeping this group so amazing. The community is amazing. And we're all doing our best. And, you know, all we can do is be ourselves and try and shine that light. And some people will feel the warmth of that light. Some people will get dazzled by it. So it's just the way it is. Anyway, thank you very much. Good night. Enjoy the rest of your weekend and see you soon. Bye.